And now we'll move on to our final presentation. I'll introduce our two speakers that will give us information on opioid jail data. Tianna Hammock, she has an extensive background in providing and overseeing compliance and substance use disorder services. She's worked as a direct substance use disorder provider for over 14 years, where she served in many different capacities, including the deputy director for a large Sacramento County program. She then worked at the State Department of Healthcare Services as a manager overseeing the drug Medi-Cal compliance unit. In this role, Ms. Hammock trained California counties on the rollout of the drug Medi-Cal organized delivery system, as well as provided technical assistance to California providers on treatment compliance. Ms. Hammock now serves as Quality Improvement Coordinator for Adult Correctional Health, with primary responsibility of monitoring and ensuring required healthcare services are provided to the patients in Sacramento County jails. Our other speaker is Brad Rose, and he is a 24-year law enforcement veteran currently with the Sacramento Sheriff's Office. During his tenure in law enforcement, he has had a diverse blend of assignments, working as a custody officer, patrol officer, field training officer, problem-oriented policing officer, street-level narcotics detective, major narcotics detective, and task force officer for the Drug Enforcement Administration. Additionally, Brad has had supervisory positions within the gang suppression unit and the reentry services unit. Currently, Brad holds the rank of lieutenant. He has a Bachelor of Science degree and is a graduate of the Sherman Block Supervisory Leadership Institute. He holds numerous professional certifications in addition to relapse prevention therapy and a variety of other evidence-based substance abuse courses. And so let's please welcome Tianna Hammock and Brad Rose.
Thank you, Janet, for that introduction. Can everyone hear me okay?
Yes.
Okay, great. I do want to thank all of the speakers today. The speakers today have been amazing. Thank you, Lori, for putting this together. And I especially want to thank Laura for her story, because I too have been under the impression that I'll see warning signs and I'll know and I can intervene. And so that's always kind of kept me safe in my own head about my kids. So I've already texted my 17-year-old and said, we're going to have a talk after dinner tonight. So thank you everyone for today. As Janet said in my introduction, I am currently the QI coordinator for Adult Correctional Health. And that is who provides all of the health services within the jail. So health services, mental health services, and SUD. And so I want to kind of go into a little bit of history. I know that we've had a really full day today in this meeting. And so I'm gonna briefly go into what I do, and I'm gonna hand it over to Brad, who can talk extensively about the new things that are happening at the Sacramento County Jail. And so for my piece, what I can say is that about 2 years ago, we entered into a grant, which was a collaborative grant for opioid expansion of MATs in the jails. And what that did for Sacramento County is that it educated some of the providers that have been within the jails for a very long time, who have their own personal opinions about MAT. It helped us train nurses on the difference between, continuing a medication versus somebody coming in on opioid withdrawal. So there was a lot of education that went behind it. And what came out of it, because it ended in March, is that we have now began a really strong process. It's been now systematic in continuing MAT medications in the jail, just as they would any other medication coming in. And that's a really big deal. Because again of the stigma and everything else surrounding opioid use. So what that means is anyone that comes in with a legitimate prescription of any of the MAT, it could be Suboxone, methadone, or Vivitrol, any of the MAT medications, we'll verify it and then we'll continue it immediately. And so that took a lot of coordination because anybody can think of nurse intake in a large jail. So to give you an example, in February of this year, there were 2,159 intakes for the Sacramento County Jail. And of those intakes, 581 reported meth use at intake and 255 reported opioid use at intake. And these are only people that admit it, right? They're the ones coming in and they say, yes, I use meth, or yes, I did that. There's a lot of people that don't say anything. So of the people that actually said, yes, I have a meth problem, so meth was actually 27% of all intakes in the month of February, which is a pretty big number. And opioids were 12% of all intakes coming into the jail. And that's pretty steady. It's a lot of people coming in, but we already know there's that number is a lot higher. So of that, what happens is that anyone that has a positive test at intake or admits any kind of substance use automatically gets a referral to our substance use counselor that is on site at the jail full time. And so our substance use counselor is in charge of doing one-on-one counseling mainly, and also connecting to the system of care, having someone at the system of care in Sacramento County come out to the jail and do an assessment, so that way upon their release they can actually go into a treatment program. So it's that kind of coordination that happens with our SED counselor, because if you can imagine, let's just say 50% of the population in 1 month, there's no way one person can see everyone. The thing is also about the main jail is that there's a high churn rate, that within 3 days, a large majority of the people are let out. And so he really focuses on the people that are staying there beyond the 10-day quarantine period, and being able to see them, see how willing they are to be able to talk about changing their lifestyle. Do you want to have a program when you get out? Just really meeting with them and saying, look where we are. There is a way that you can prevent coming back here ever again. And so that's really something that we've been developing more of on the health side. And but a major component is something that Brad is going to be talking about that has developed in the main jail this year. And so I want to hand it over to him, because historically, within the 2 jails that we have within Sacramento County, we have the main jail downtown, and then we have RCCC out in Elk Grove. And a lot of the services in the past were kind of tailored towards RCCC, because that's where sentenced people would go. And so people that knew that they had a year to serve or however long to serve, they would be able to, work with them because they knew how long they had to work with them. Within the main jail, there's not really that, sentenced population to work with. So it's been a little bit harder to provide those kinds of services. But Brad Rose and his team figured out a way. And so I'm going to go ahead and hand it over to him.
Great. Can everybody hear me?
Yes.
Yes, so just historically, the Reentry Services Unit of the Sheriff's Office is, as a bureau, we have kind of led the change in justice reform to changing jails from a punitive standpoint to one in which we engage people with people and services solely for the purpose of changing behaviors, not to punish anybody, but to engage people with a number of programs and a large number of dedicated professionals to get people an alternative to the lifestyle that often landed them in custody. And for a majority of those, based on prior studies, we know that they all suffer from a substance use disorder, or in the population now, a growing number of people that have opiate use disorder. So the Reentry Services Unit started a medication-assisted treatment program back in 2012. It was one that was focused on antagonist medications. And over the time and through our trials and tribulations and our collaborative relationships that we've built with Tianna and her team and Lori Miller and her team is we've recognized that not everybody that's engaged in treatment is ready or appropriate for antagonist medications. So we've expanded. We've expanded to Suboxone and then for methadone in some populations, which is again our mission to not only get people engaged in treatment, but to have them continue in treatment. So through these relationships with some of the county agencies and a number of community-based organizations, and the success, the great success that we've had at the Rio Casumas Correctional Center, we were tasked with ensuring that the umbrella of reentry reached offenders at the main jail as well. And so we've expanded treatment services, both in custody and post-release, to offenders who are housed at the main jail. Again, this is a collaborative effort that begins oftentimes with adult correctional health and identifying people who suffer from substance use disorder, and for people that we can direct to a validated risk and needs assessment, which identifies 8 different criminogenic behaviors that are proven to increase incarceration rates among individuals. Those areas are education and employment, family, marital history, leisure and recreation activities, companions, alcohol and drug problem, which is extremely important, pro-criminal attitude, and antisocial patterns. Historically, the alcohol and drug problem has been our primary focus because in 2013, the county participated in the Arrested Drug Abuse and Monitoring Program. And of all the study sites, Sacramento led with over 80% of all individuals that came into custody testing positive for 1 or more drugs at their time of booking, and that didn't even include alcohol. So if anybody in Sacramento County needs an eye-opener as to how big of a problem we have here, look no more than that study. We have no study or information that indicates that those levels are trending down. What we're seeing is that opiate use disorder is going up while methamphetamine use has remained relatively steady. But the other thing that this study showed was the average age of individuals who were using opiates, whether it be for the first time or to where they admitted that it was becoming a problem in their life, has gone down significantly. To a lot of individuals having their self-admitted first experience with opiates, including prescription medications, prior to 18. And so, as we've heard from some of the other presenters, that is a demographic where the only way that here in Reentry we have a real opportunity to influence that is through parents and changing parents' behaviors and getting parents more engaged with their children through all of our vocational, educational, and treatment programs. When I talk about validated risk and needs assessments, especially the alcohol and drug problems, through our collaborative efforts and the scoring, we have shown that we can reduce the scoring in that behavior 23% with 6 months in custody. And the longer people are in custody, the longer we can engage them with not only case management, but treatment services. We see that percentage actually increase significantly. One of the other things that we offer is we are the national gold standard when it comes to residential substance abuse and treatment in a correctional environment. And so since 2012, we've been keeping recidivism data on the number of individuals that we are not only engaging with treatment, but are returning to custody within 3 years of release. And for that program, we have a recidivism rate of 29% in males and 9% in females. And to give a kind of a scale, to look at is that historically recidivism rates in the state of California have hovered between 67 and 73%. So the collaborative efforts, the identifying of criminogenic behaviors, and the collaboration amongst a number of partners to provide these services has become kind of the recipe for success, and made our county, not just our correctional facilities, but our county, a national model. And so for everybody that's part of this, and everybody that is dedicating their time and their efforts to this, that's your reward, is to know that when I travel the country, everybody looks up to this county, and you all are rock stars. And I'm honored to be part of this and to work with such a great group of dedicated individuals. So thank you.
Thank you, Tianna. Did you have any other information that you need to share, Tianna?
No, not for me today, but just really excited to really have the same kind of resources that have always existed at RCCC to create those outcomes, right? To prevent that recidivism is now expanded also to the main jail. So that's been a huge undertaking. And I really want to give Lieutenant Brad Rose some kudos for that, because he made it happen.
That's awesome. Thank you so much. Are there any questions for our presenters here? Okay, checking the chat. Oh, just a couple of messages. Okay, there are no questions. It's a lot of accolades to all our speakers today, and for all the hard work that they are doing in educating our community on opioid and fentanyl misuse, and also in providing resources to like those in the jails, and and educating our our teens and children in schools, and I really we really as a coalition appreciate all your efforts that you are providing to our community, and hopeful that we're making strides in the right direction to get this epidemic under control. And so I just again want to remind everyone that we will be sending out an email with all the presentations from the presenters today, and also flyers on all of the events that will be coming up. This is our last meeting for this calendar year, and we will be sending out a calendar of the meetings for 2022. Hopefully at some point we might be able to actually meet in person instead of virtually, but again, we're doing the best that we all can in this environment. And so we appreciate your attendance, and we hope everyone has safe holidays coming up, believe it or not.